In this next part of the session, we'll take a closer look at the philosophy and the principles that underpin naturopathic medicine. As we saw earlier in the definitions for naturopathy, the key aspect of the naturopathic approach to healthcare is that the practitioner works with the body's inherent ability to maintain a state of balance, or what's called homeostasis. And this is a capacity that's found in all living organisms. I think it's worth mentioning also that some scientists perceive that our planet is in fact a living self-regulating organism in itself, and that it too has a capacity to restore and maintain a state of balance given the right conditions. So there are 6 main principles of naturopathic practice. There's vis medicatrix naturae, or the healing power of nature. These are all written in their original Latin, and so I'll explain what they mean in more detail as we go along. Primum non nocere, or first do no harm. We have tolli totum, or treat the whole person. Tolli causum, which is treat the cause or the causes. Docere, which is teacher or teach the patient. And the 6th principle of naturopathic practice is preventer, or prevention. So let's have a look at each of these in some detail. So firstly, vis medicatrix naturae, nature's capacity to heal. So the word health originates from old English words, health and help, which basically mean whole or to make whole. So when we talk of health, it means a state of wholeness, a state of balance. And healing is the process of returning to a state of wholeness or balance. So vis medicatrix naturae is the ability of nature, or if you like all things in nature, to maintain a state of balance. And if imbalance occurs for whatever reason, then nature will do its very best to restore that balance, to restore a state of wholeness. So if we look at an example of this, when you cut your finger or when you fracture a bone perhaps. So as long as we provide the right conditions, in the case of a cut, as long as we keep the wound clean to avoid infection, in the case of a fracture, we simply immobilise that affected part, then if we do those things, the body's innate capacity for restoring balance will heal the cut, will mend the fractured bone. And this is in fact vis medicatrix naturae in action. Applying that on a macro scale, if for example a bushfire burns through a forest, leaving it blackened and seemingly lifeless, in time, given the right weather conditions, etc., slowly that environment will be restored to a balanced ecosystem again. So without any intervention, without anything done necessarily or forcefully, nature's innate capacity to restore to a state of wholeness, to a balance, will do the job. The next thing I guess we look at is that the term that's given to this innate capacity, this power to restore to a state of wholeness, is referred to as the vital force. And systems of medicine or approaches to healthcare that acknowledge and utilise this power, this vital force, are referred to as vitalistic. They're based on this principle of vitalism. Now most of the whole medical systems that we mentioned previously are vitalistic. So in traditional Chinese medicine, this force or this power, this energy, is called qi. In Ayurveda, the traditional healthcare system of India, it's referred to as prana. And in the Unani Tib system of medicine, they refer to it as kuwate mudabira. But in each of these cases, what they're talking about is the vis medicatrix naturae, the healing power of nature. So when we apply this principle, this first principle, in naturopathic clinical practice, we do it in several ways. Firstly, therapies that work with the body's innate self-healing capacity are certainly preferred. Usually these will be therapies such as herbs, foods, nutrition, exercise, rest and relaxation, which are all natural and for which the body has evolved physiological and chemical pathways to utilise effectively. Secondly, patients are taught and also encouraged to make lifestyle choices that are healthy or wholesome and in harmony with nature. And these wholesome choices always support the vital force, support the vis medicatrix naturae. Thirdly, the naturopath supports the vis medicatrix naturae, the vital force in the patient, by identifying, removing causative factors to the state of disease or ill health. And this is referred to in naturopathic practice as removing the obstacles to health and recovery. Finally, the signs and the symptoms of a disease are often the manifestation of the body's attempt to defend and to heal itself via the vital force. So an example of that would be an individual contracts an infection. It might be a flu virus or another type of virus, and one of the early signs of this infection is a raging fever. And this fever is nature's way of fighting the infection and preventing the infection from spreading even further. So it's nature's way of limiting the infection. Unless the fever is too high to the point of causing potential harm, the fever should be supported and managed rather than suppressed. Acute inflammation and swelling is another way that the vis medicatrix naturae responds to manage a physical trauma or infection. And in the short term, once again, this inflammation and this swelling should not be suppressed. If it perseveres, if it continues for a longer period of time and it's depleting the vital force of the body, then the naturopath may need to intervene with natural anti-inflammatory approaches to reduce the swelling, to reduce the inflammatory signs. But we're also very careful that we treat the underlying contributing factors so that we're not just taking away the signs and symptoms. So the naturopath needs to look at the signs and the symptoms of disease from the perspective of what they represent in terms of the body's innate self-healing response. And this will have a bearing on the treatment plan for the condition. The second naturopathic principle is primum non nocere, or first do no harm. And it's worth making the point here that first do no harm is one of the key precepts of conventional medicine and was actually included in the Hippocratic Oath that originated for physicians back in ancient Greece, back in the time of Hippocrates. So it was one of the key features back then. In applying this principle to treatment, the naturopath considers what would be an effective and a safe treatment plan for the patient. And this involves consideration of a range of different therapeutic agents that the practitioner has at their disposal, but also consideration of a hierarchy of treatment options known as the therapeutic order. The level of therapeutic intervention may be as simple as proposing dietary or lifestyle modifications, or it may require a higher level of intervention such as nutritional supplementation at a fairly high therapeutic dose, or herbal analgesics to ease pain or discomfort until the cause of the problem can be effectively addressed. In some cases where a patient's health condition is quite severe or quite extreme, the highest level of intervention may be essential, and this could be referral to a general practitioner or to a hospital for assessment, for pharmaceutical drug intervention, or perhaps even surgery. Where a health condition is chronic, in other words, the disease has been present for some time, and so the signs and symptoms are usually quite severe, a higher level of intervention is normally necessary. For example, this might include a number of therapies. It might include nutritional supplements, it might include herbal remedies, it might include homeopathics, dietary or lifestyle change, and the dosage of the prescriptions may be at the higher therapeutic range, or they might need to be taken more frequently for a period of time. Natural remedies, or remedies that are as close as possible to their natural state are always highly desirable for prescription as therapeutic agents, because they're being natural, they're far less likely to cause side effects or adverse reactions. This doesn't mean that all natural agents are always safe and for everyone though. So the naturopath does need to be vigilant and also needs to be very aware of any possible reactions that a patient may have to any remedy, regardless of how natural they might be. The principle of first do no harm also extends to diagnosis and health assessment methods. It's responsible for the naturopath to consider what level of intervention is necessary when it comes to conducting or referring for pathology, laboratory, X-ray, or really any type of diagnostic tests at all. Again, depending on the severity of the condition or the complexity of a health condition or disease, it's sometimes necessary for a higher level of intervention. But if it isn't, then a lower level should be employed. And of course, when we talk about harm, that should be considered from the perspective of not only physical harm, but also emotional, psychological, and also financial harm when it comes to treatment and also to diagnosis. The next of the naturopathic principles is Tolu Totem, which translates as treat the whole person. I mentioned earlier that naturopathy, like Ayurveda, traditional Chinese medicine, Unani, and also Tibetan medicine, is a whole system of medicine. And in addition to having a philosophy and a set of principles, as well as being able to, or rather, as well as being based on the concept of a vital organising force, all of these whole medical systems consider the whole person when treating an individual. So considerations given to not just the physical signs and symptoms, but also the emotional, the psychological, and the spiritual aspects of the patient. A reductionist perspective or approach to disease focuses largely on the signs and symptoms, an understanding of the pathophysiology of those signs and symptoms, and also a differential diagnosis that fits those signs and symptoms. By comparison, a holistic approach to disease and health takes into consideration certainly the signs and symptoms, but more importantly the multiple factors that relate to those conditions, the contributing factors, but also the resulting factors or issues that the condition contributes to. To illustrate this, let's look at the situation of a patient who's been diagnosed with chronic fatigue syndrome, which is a chronic condition that's characterised by multiple symptoms, including things like debilitating fatigue, headaches, muscle pain, poor concentration and memory. Now, imagine how this person's life would be if they've been experiencing these symptoms of chronic fatigue syndrome for 3 or 4 years. It's going to affect the way they feel, their emotions, and it will influence them psychologically, their attitude towards things like exercising or going out socially. It'll probably affect their ability to work, and if they can't earn a living, this may certainly contribute to issues of low self-worth, depression, anxiety, and possibly to even question their purpose in life. So this condition, chronic fatigue syndrome in this particular case, has touched each aspect of the individual's self, their physical, emotional, mental, psychological, and perhaps even the spiritual aspect, so that they're asking questions like, who am I, where am I going, what is my purpose in life? Furthermore, how they're feeling emotionally, psychologically and spiritually will quite possibly over time contribute to the severity, the complexity of their condition. So it's a two-way thing in that regard. So I like to differentiate between illness and disease. To me, disease is the structural and functional abnormalities associated with what's happening in the body. Illness is the patient's experience of the disease. All the difficulties, all the frustrations, the complexities that go along with the condition. Things like uncertainty, fear, loss, dependency, etc. As a holistic practitioner, the naturopath must at least address these various aspects, the physical, mental, psychological and emotional and perhaps spiritual. And although the naturopath may not be trained to address some of these, they should know when there's a need to refer the patient to professionals who can address these different aspects of the whole self. The other aspect of Tolly Totem is that by treating the whole person, we're acknowledging that each individual is unique with their own specific strengths and weaknesses, their own unique way of manifesting an imbalance. So if a naturopath is treating 5 different patients for chronic fatigue syndrome or asthma or acne or anything else for that matter, it's most likely that each of the 5 will receive a slightly different or very different treatment. As Dr. Edward Bach, who was the originator of the Bach flower essences, said, treat the person, not the disease. So each person as a unique individual with a unique manifestation of health needs to be treated individually. The 4th naturopathic principle is tolli causum, or treat the cause, or causes. This principle follows on fairly closely from the last one that we looked at, Tolly Totem, treat the whole person, because, as I said, illness is a multifactorial entity. There are physical, psychological, emotional, spiritual, as well as other factors like environmental and social aspects that interrelate to each other where the disease is present. So there's rarely ever only one cause of disease. In reality, there are usually numerous contributors. And the naturopath has to try to develop an understanding of all of the causes or contributing factors and to then prioritise those so they can be addressed appropriately. So as the slide there says, time is taken over a number of consultations to gather as much relevant information about the patient as is possible. And from this information, the naturopath develops an understanding of the various contributing factors to the health condition and how they may be best managed by way of an individualised treatment plan. Now in naturopathy, iris analysis, or iridology as it's also called, is a tool that's used for gaining a really useful amount of information about not just the person's health condition but inherited weaknesses that may predispose the individual to certain diseases, and also how well and how quickly an individual may respond to treatment. From signs in the iris, we can also get an indication of what nutrients or what herbs may be important as part of the treatment plan. So iridology is a useful treatment tool. It doesn't provide a definitive diagnosis, but it shows us patterns in the iris that can correlate to patterns of strength and weakness within the body, which enable us to gain insights into what sort of conditions the person might suffer in their lifetime. Unless the various causes or contributing factors to disease are identified and addressed, it's unlikely that a complete resolution to the health problem will be achieved. And this can mean that the disease degenerates further, becomes a lot more complex, and consequently treatment becomes even more challenging. With the degeneration of disease from the acute stage, the early stage, to a subacute, to a chronic, and to the degenerative stage, the vitality or the vital force of the individual progressively weakens, and this always makes it more difficult because therapeutic intervention needs to be a lot more aggressive in these chronic and degenerative stages of disease. Docere, or doctor, actually means teacher, and in traditional societies the healer or the doctor is considered to be I suppose, a wise person, somebody who imparts their knowledge about health and well-being, but also as well as illness and disease to the community. Because naturopathic philosophy is based pretty much on the laws of nature, and naturopaths promote a lifestyle that follows these laws, it follows that naturopaths spend a great deal of time providing patients with information, motivation and counselling about how to adopt a healthy lifestyle. And I guess this is one of the reasons that a naturopathic consultation usually takes much longer than an appointment with some other healthcare professionals. Self-help measures and goal setting and motivating patients to initiate and to maintain changes to their lifestyle habits are a really important part of naturopathic treatment strategies. When it comes down to it, my experience is that the changes that patients make in taking responsibility for their own health are really the things that have the most effective and long-lasting results. There's quite a bit of research that shows that the therapeutic relationship, that's the relationship between the practitioner and the patient, contributes significantly to improvement of the patient's health. That's even before any nutritionals, any herbs, any homeopathics or other treatment are prescribed. So building a strong and a healthy practitioner-patient relationship is important for the purpose of encouraging the patient to undertake changes recommended by the practitioner, but also for the purpose of contributing to the improvement in health. I think that a strong therapeutic relationship also helps with patient compliance with the treatment plan. The sixth and final naturopathic principle is preventer, or prevention is better than cure. Here we have a quote by Henry Lindler, who was one of the pioneers of naturopathic medicine in the United States, and it goes back to the early 1900s. And Lindler said that there are two principal methods of treating disease. One is the combative, the other is the preventive. The trends of modern medical research and practice in our great colleges and endowed research institutes is almost entirely along combative lines, while the individual progressive physician learns to work more and more along preventative lines. And I think it's fair to say that this is even more so, even today. It's always easier and less painful, physically, emotionally, psychologically, spiritually, socially, and most certainly financially, to prevent disease and illness in the first place. Prevention has always been a cornerstone of most traditional and whole medical systems. In fact, you've probably heard that in ancient China, the physicians were paid to keep people healthy, to prevent disease from occurring in the community, and they were paid to achieve this. When they weren't successful and a disease or illness occurred, payment was withheld to the physician. So prevention was an extremely important strategy back then. Given the enormous cost of healthcare in the Western world this century, together with the ageing population, governments globally are looking for ways to rein in the health dollar, to reduce the health budget. And preventive strategies are really the only answer. Naturopathic practice has always recognised this, and we acknowledge that prevention is a continual and ongoing process. From the moment of birth, and really even when you think about it throughout gestation, prevention must be considered. So health is a dynamic, ever-changing state. It's not something that is achieved and then we sit back and enjoy that state without having to put in any effort. Health and prevention of disease is something that each individual determines by way of the choices they make, every moment of every hour of every day of their life. And I just want to leave you with a saying that I like to share with my patients in relation to prevention and good health, and that is that it's the things that we do, the thoughts we have, the choices we make each and every moment that determine our reality, our degree of happiness, health, well-being and also good fortune are all determined by these choices. So my word of advice is choose consciously and choose carefully.